Welcome to Kangaroo Care Women and Children Hospital. This is a doctors-driven hospital. Equipped with cutting-edge technology, Kangaroo Care Women and Children Hospital.
I am Dr. Preeti Gowda, practicing at Kangaroo Hospital, Vijayanagar, as a consultant obstetrician and gynecologist. Okay, hi everybody. The topic which I have chosen today is menopause. Of course, it is a dry topic. I don't know how many of y'all will be interested in listening to this menopause, but all of us, keep it in mind, all of us, all women will go through this transition of life. We have to undergo. It is a common phenomenon. So menopause is not a disease. Okay, you have to remember, menopause is not a disease. Like menarche, which is a must, which occurs in all females, menopause also is something which occurs as a normal thing and as a normal physiology. Okay, so what happens during menopause? Menopause is the cessation of occurring of this monthly menstruation. So if you are getting your periods regularly on a regular basis monthly in a 28-day cycle, and you stop getting this menstruation for a period of 6 months, then you call it a menopause. Or if your cycles are very irregular, then the cessation of this menstruation for a period of 1 year is taken as menopause. Okay, now that you have understood what is menopause, let me tell you what happens during this pre-menopause, menopause and post-menopause. Okay, so this menopausal symptoms, what we say, this menopausal symptoms will start off even before the proper menopause occurs. Fine. So that period is taken as perimenopausal age. So in this perimenopausal age itself, you will have certain symptoms which will be really irritable to all women. Okay, so what all happens is, once we have to remember that we start getting these hot flushes. Hot flushes means what happens? All of you all will come and tell me, okay ma'am, I am getting hot flushes. What is this hot flushes? It is a kind of flushes or increased sweating that you get throughout your body, which lasts for around 1 to 2 minutes, and these symptoms will mainly occur during the night times, and it even disturbs your sleep. So when it disturbs your sleep, that is the time when you need treatment. Okay, this is hot flushes. Then coming to what happens to your menstrual cycle. Your normal menstrual cycle can get delayed. So one who is getting a menstrual cycle at 28-day period, then it can become 35 days, 40 days, and like that it can prolong, and then one fine day it can stop. Okay, so people will be asking, during this menopausal age group, I might get heavy bleeding. You can get heavy bleeding, which is also normal during menopausal age group, but you have to get a consultation of the obstetrician to say that it is normal and it is not associated with other endometrial problems. Okay, so keep it in mind, everyone come to the doctor and she says that, madam, my neighbor told me or my sister told me that gradually my period will stop by getting more menstrual flow. That is not true in all the patients. So please keep it in mind that if you are having a cycle which has got more flow, or the number of days is increased with menstrual flow, that is the time you have to consult a doctor. Don't think it is one of the symptoms of menopause. Okay, unless it is ruled out. Fine. So your menstrual period or the days or the heaviness of the flow, everything changes during menopause. Okay, and very rarely you will come across people who will say that my period just stopped. So but these things happen in a very rare case. Okay, so these are the menstrual changes that happen during this menopause. So apart from the menstrual changes, what all happens? So one thing is, we become irritable. We go in for phases of depression. okay, and we get angry very soon, or we come low very soon, we cry without reason. So these are the symptoms of these kind of psychological problems that we face. Fine. So psychological problems and psychiatric illness both being apart, okay, these are normal things which every female or most 80 to 85% of the females face at this menopausal age group. Okay, this is regarding the hot flushes. Then coming to what happens to our urinary symptoms. The urinary symptoms, that is frequency of urination or burning during micturition, these are the problems that we face in. So these symptoms, we call it as urinary tract infection, which is taken during the reproductive age group. But during this menopause, even when we do a urinary routine examination, we come across that urine examination becomes normal. Okay, but these symptoms still persist because the urinary the hormones which keep the urinary tract in a good way, all that is disturbed, and there will be vaginal dryness, of which there will be vaginal irritation causing more infection and then decreased libido, or you can have something called as dysperonia. Fine. This is because again there is decreased amount of estrogen secretion that is coming from the ovary. So ovary is waning and going in for a decreased estrogen secretion, which is very important throughout our reproductive life. So when this estrogen hormone decreases in our body, that is the time when all these symptoms start off. Okay, and one more good thing about this estrogen which we have during our reproductive age is the estrogen helps us in protecting our heart. So till the age of menopause, the incidence of women getting heart attack is at a lesser incidence. Once she gets the menopause, once she starts with the menopause, that is the time when the heart attack incidence increases. So estrogen is very protective for us, unlike the men. So men's incidence is more, they have more incidence of heart attack in the early age group and then less after 55 years. Here women are protected till 55 years and we get increased incidence of heart attack after 55 years. Okay. So then, and one more thing is, because of this estrogen, our bone weakness starts, the strength of the bone decreases. So again, this estrogen has got a protective function towards the heart and towards the bone. Okay, there are so many good functions of this estrogen which is there with us throughout our reproductive life, and once this menopause occurs, we get into so many problems which is physiological. Okay, now coming to the treatment part and the investigation part of menopause. So how do you diagnose menopause? Diagnosis is very simple. You do just a hormone called as follicular stimulating hormone, that is FSH, and once this value increases around double fold, that is more than 30 international units, then is the time that we call that this lady has gone into menopause. Fine. And the estrogen levels dramatically decreases. Okay, this is the diagnosis for menopause. So how do you treat this menopause? Now you know all the menopausal symptoms and what we have to do to treat the menopausal symptoms. Now you know what happens during menopause. There will be a decrease in secretion of the estrogen. So what we should do? We should give estrogen in some mode. But this estrogen, giving it orally or parenterally, has got its own side effects. So we cannot give estrogens to all the patients to so-called menopause who have attained menopause. So just because we have attained menopause, it doesn't mean that all of us have to take estrogen. So before getting into yourself to a treatment, please visit your doctor, because she has got wide variety of treatment which has to be given and which is individualized. The pros and cons will be explained to you, because you might have other symptoms wherein estrogens should not be given. So the minimum thing which can be given to these menopausal ladies is, so you can advise to have a good exercise, take more good diet, more oral fluids to avoid urinary symptoms, and then do exercise and yoga, because you are in that depressive phase, which will help. Okay, apart from all this, apart from your good diet, apart from your exercise, apart from your aerobics, apart from so many other things, you have to take calcium, so which is very much needed. The patients or the women who are not on estrogen replacement therapy, that is the estrogen therapy, have to take calcium throughout the day, throughout her life, at least 1500 grams per day. But what happens here is all women will not agree to take that much. All of them feel, if I take more calcium, I will get into some stone problems of renal tract. So they don't want to take. So I advise at least every woman to take 500 milligrams of calcium per day. The advised dosage is 1500 grams per day, which has to be taken if they are not on HRT, that is hormone replacement therapy. So all women have to take calcium to keep a good health and to avoid osteoporosis. All this calcium replacement therapy has to be started at an age of at least 35 years to 40 years, because that is the time when our ovary will start waning off in the sense the estrogen secretion start decreasing or the ovarian function starts decreasing. So menopause, to tell you, is not a disease. It is a physiological change that occurs to all women, and all women have to try to cope up with this problem without causing any harm to ourselves. So main thing in menopause is, all of us think that once we get into menopause we start getting some disease. No, there is no disease at all. Only thing is, you need lot of support from the doctor, from the obstetrician, and lot of support from your family members. So when you get into this menopause, you feel that you start having this palpitation, you think that I have some heart disease, you think your anxiety is because of some disease underlying, you start thinking that you are getting cancers in your life. No, but go to the doctor, rule out all your problems, and the main thing you need is only the support, the psychological support from your obstetrician and the family members in and around you. Thank you.